It's my feel-good breakfast show.
Welcome back. It is your feel-good breakfast show, Expresso on S3, and it is Tuesday, which means we are talking medical. And cardiovascular disease is the world's #1 killer when it comes to non-communicable diseases. Now, claiming over 18 million lives annually. Now, as a way to fight this, World Heart Day was founded to create awareness around heart disease and associated conditions.
Yeah, now this morning we've got some specialists in the building. We're joined by medical specialist Dr. Darren Green and Professor Naidu, the CEO of the Heart and Stroke Foundation. And if you have any questions, Nzanji, then come through and let us know, because our specialists are here to take over and help us and assist you on any of those questions. So you can write to us on our Expresso Facebook page, come through those questions, and we will more than likely try our best to answer them. But let me firstly say welcome, guys. How are you doing this morning?
Yeah, thank you so much. Great to be here.
Oh, well, I'm very excited for today's topic because it's something that I'm going to say it's close to home. Doing one of those DNA analysis, they said to me, you got all your mom and dad's bad genes, so I need to look after my heart and my health. So I think, Prof. Naidu, if you want to take this one, or Dr. Darren Green, but let's first start off with what exactly is heart disease and what are the different types we can get?
Sure, there are different ways of looking at the types of heart disease. You can look at it from a structural component, anatomically is what we say, and there's something can go wrong with the heart muscle itself or the blood vessels that are supplying that muscle with blood and oxygen, or of course the nerve supply to the muscle that gives you your heart rhythm and tells that muscle when to contract. And then of course you could have other problems with the blood and etc. that moves through the heart. So the cardiovascular system involves the heart and the blood vessel. That's anatomically. But you also could look at it from a different perspective in terms of what's called pathology, what can go wrong, and things like the pipes becoming clogged with atherosclerosis. That's where you have deposits of fat and lipid blocking the arteries, for example, as well. Things like infections that affect the valves of the heart can also come into play. And then things that damage the heart muscle, whether it's toxic, whether it's alcohol, etc., also play a role. And then you get congenital, that you're born with certain defects of the heart, and then some family traits that could come through as well.
Oh, now, I know Zoe was speaking about that, and it sounds like there's a lot that can go wrong with it, but it's such an important part and a vital organ of the body. What are some of the signs and symptoms that might show perhaps that there's something wrong or there's an issue here?
Yeah, so I'm a public health specialist, so the actual sort of medical implications I will just pass over to Dr. Green. But so essentially, I think it's important to understand that oftentimes you don't even have the signs and symptoms. Okay. So there are classics, which Dr. Green will tell you about, but there's often what we call silent disease, if you like. So hypertension, for example, which drives cardiovascular disease, so high blood pressure. It's often you don't know that you have severe high blood pressure or increased levels of cholesterol. So it's complicated, you know, just the way Dr. Green's just explained the anatomy and the pathophysiology. It's like such a complex topic because what drives heart conditions is not simply the structural defect. It's got a whole range of drivers, let's put it that way. So there's social determinants of health, for example, and oftentimes that poor people suffer worse health. And then if you have familial history, Zoe, then it's going to complicate the whole risk association.
So are you saying it's potentially something then that could develop to a point where you then only almost at the last point experience that symptom without even knowing it?
You asked about the signs and symptoms. So people typically speak about chest pain, angina, a heart attack. And that typical crushing chest pain with like an elephant sitting on your chest, possibly radiating into the left arm, into the jaw, or across the chest, etc., associated with nausea, vomiting, and sweating. That's your like textbook case of a heart attack. That is, as I say, the end result of this process that you've described that can happen over such a long period of time, where that artery becomes blocked slowly and gradually, and one day there's just too little blood getting through that part of the artery, and that part of the heart doesn't get enough oxygen, and that's when you have a heart attack, where there's too little oxygen and it dies off, actually damaging the heart muscle. So the range, as I say, of symptoms that you get is often at the end or at a place where it's actually a little bit too late to reverse the damage without doing an intervention like stents or bypasses and that kind of thing. So we want to prevent people getting to that
Before we even
Correct,
get
yeah.
close to that.
And so just linked to the signs and symptoms, it's also people need to be aware that there are other conditions that actually drive ultimately heart disease.
Yep.
So if you're diabetic, for example, have high blood pressure, you know, so it's those combination of, so those are the signs and symptoms you need to look out for as well, not just the end result.
I could not think of a better answer. We've got the absolute specialists here, guys. Thank you so much. Really, I'm honestly getting educated, and I think the rest
We're
of the
trying.
And this is a scary topic, so of course, if you do have a comment or a question for Prof. Naidu or Dr. Darren Green, please head on over to our social media pages. We will be back with them shortly, and we'll get to all of those questions you might be asking.
It's my feel-good breakfast show.
Well, you're back just in time as we continue our conversation around our health. Now, the heart sits at the center of the circulatory system, pumping blood around your body as your heart, as your heart beats, and all the while also really delivering oxygen and nutrients to all parts of your body. Now, we are back with our medical specialists, Dr. Darren Green and Prof. Pamela Naidu, the CEO of the Heart and Stroke Foundation. So if you have any questions that you would like to ask our specialists, just head on over to the Expresso Facebook page and ask your question over there. We'll get to them shortly.
Yeah, guys, so the earlier conversation was very informative, very educational, and we're speaking about heart disease. Now, the question I have is, you have these moments where you find out either from your GP or a specialist that you might have heart disease. How exactly is that developing? What would cause that? I know we spoke about a lot of the pathological instances, about those build-ups exactly, but more importantly, it's how would someone develop it over that long term? I'm really trying to get into that crux. I don't know if you could share more light on that, Darren.
Yeah, I think we'll both contribute. I think one of the first things, there's the acute stage of what's happening when the heart is not getting enough oxygen. So that happens within hours, over a period of hours, when the blood flow or blood supply is cut off to certain parts of the heart. You'll hear people speak about the coronary arteries, etc.
Yes.
They can go into spasm, by the way. They've got muscles in their walls, or they can just be blocked because of all the cholesterol that's busy blocking it, etc. Or there could be a thrombus, which is a clot. So that said, that happens at the end. Often, there's interesting research that's been done that say people often have warning symptoms a month leading up to the heart attack, where they might have small bouts of chest pain or excessive fatigue or weariness that they can't explain. In ladies, we often joke and speak about koa footer, cold feet and hands. Okay. Decreased peripheral circulation is another sign of heart disease, that there's diminishing function to the periphery as well. So one must remember that. But as you say, those symptoms at the end are over a period of hours. The warning symptoms a month leading up to that are often the associated medical conditions like you mentioned. The hypertension, which doesn't really have a headache as a main symptom, by the way. That's a bit of a myth. Hypertension can give you dizziness, and it's referred to often as the silent killer because you don't know clinically that you've got high blood pressure. So you need to check routinely to diagnose it. And then uncontrolled sugar. I always speak about the 3 Ps, polyuria, when you're going to the loo too much and getting up at night to go to the toilet more than 3 times or 4 times. When you're eating and you're not getting full, that's another one, polyphagia, and then obviously polyuria, polydipsia, and then thirst. When you're extremely thirsty and can't quench your thirst, those are warning signs, and deep energy slumps that your sugar could be a problem. So the one facilitates the other. And problems with sugar cause inflammation in the blood vessel wall that allows the fatty deposit from your high cholesterol to go and stick like Velcro on the inside of that wall.
Okay.
So thus it's important for us to control the sugar and the blood pressure and then the sedentary lifestyle of getting moving, because that will also then assist, obviously, with reducing inflammation in that system.
Okay.
So just to quickly add to that, also the behavioral component of, so you end up, when you have the symptoms, you say to your doctor, I don't feel great. However, the very same GP has been telling you over the last 5 years that your blood pressure is too high, you need to eat better, you need to, engage in more physical activity, so on and so forth. But human nature as such, people don't just uptake healthy behaviors. Now, Dr. Green used the term lifestyle. I don't like using that term because I'm a behavioral medicine specialist. It's really all about behavior.
Yeah.
The doctor's behaving well. He or she's telling you this is what you really need to do. This is your kind of repertoire of what you should engage in, shouldn't engage in. But you as the patient you don't follow through, and then you end up in the acute phase where you kind of like on the deathbed. So it's really about what are the drivers over and above those sort of medical conditions.
Yes. All right.
Now, when it comes to that point where you now realize, oh, the cholesterol spiraled out of control, there's hypertension, what are some of the treatment plans when it comes to tackling the various things when it comes to heart disease? Because I know it leads to operations, and I suppose that is probably last resort that a doctor would want to go to.
Yes, so the first step is prevention. So primary prevention of strokes and heart disease involves increasing your physical activity level. We were speaking about the word physical activity. You're an expert in physical activity. I've seen you and sweat while watching you. So the issue with physical activity is it doesn't carry the same negative emotional load as exercise. For some people, the word exercise is a swear word. So,
No, none of that, please.
So physical activity also creates a different impression that you can increase the demand on the heart muscle and let it work harder and develop, obviously, the benefits of exercise in the other systems of the body just by increasing your activity level or rate, whether that's line dancing for old people, whether that's hiking on the weekend, whether it's walking to the shop or parking your car
Almost
a little bit further.
movement, yeah.
Any movement benefits the joints, stimulates stem cell growth with pressure on the bones and the cardiovascular system. That's the thing. So, physical activity, obviously, right at the top of the list. Managing your comorbids or your non-communicable disease like hypertension and diabetes is essential, but what we're trying to do is not let you get there in the first place. And that involves, obviously, being vigilant about your behaviors around things like salt intake, for example, with your blood pressure. And as South Africans, we love our spices on our choppies and braais. We love it. That all contributes to the problem, And then medically, obviously, we look, at controlling the blood pressure, controlling the sugar. And often you don't need medication to control those things if you change your behavior and your cognitions and your mindsets around the role of food in your life, the role of activity in your life, etc., etc. Then eventually, sometimes not everyone ends up on drugs, medical drugs, that is. So there's a lot we can do in that sense before getting to a place where you need stents and angiograms.
Absolutely, yeah. So as far as nutrition is concerned, because remember, nutrition and physical activity go hand in hand.
Yes.
So it's just actually quite simple, because you just have to remember, reduce your salt intake, reduce your sugar or cut it out completely, and fats. So, the unhealthy fats. And, of course, tobacco smoking. It's that's a zero, no. But, you can reduce everything else, but you have to stop tobacco smoking. Yeah, absolutely. So just from the Heart and Stroke Foundation, South Africa side, we have the Heart Healthy products, which is the Heart Mark, and Lucky Star is one example of that, where, fish products. And, so, sort of consuming, exactly. Look out for the Heart Mark.
I love it. I'm getting educated and I'm loving this conversation. We're diving into some important things right now. Movement, changing your behavior and your relationship with food. But we're going to continue this conversation in just a bit and get to answer some of your questions with heart health and everything else. So don't go anywhere. Here's G with some more.
It's my feel-good breakfast show.
Welcome back. It is your Feel Good Breakfast Show, Expresso on S3. We are back with our specialists as we talk Heart Awareness Month and World Heart Day, which is officially tomorrow. Dr. Darren Green and Prof. Pamela Naidu, they are with us, and we've asked you to ask your questions on social media, and this is what you had to ask.
Yeah, so we had so many questions coming through, and our first one was from Jabulani. Now, you asked the question, what is the most vulnerable age for one that can get an experience or experience a heart attack? So, youngest age or the most vulnerable age to experience a heart attack, is there an answer to that?
Yeah, so I think that, about 5 years ago, I would have said perhaps over the age of 45, you need to be, But times have changed. Yes. And so we've seen that with COVID as well. Younger people are getting sicker. And so I think if you have a family history and you in your 35s, between 35 and 40, you should really have your vitals checked. Okay, but moreover, I think it's not just about like an age; it's about gender as well.
Okay.
You know, so women, for example, pre-menopause phase, menopausal and post-menopausal women have to be extra careful as well.
All right.
So yeah, you know, it's not So there's a range of ages, I would say.
Beautiful stuff. Thank you. And
Yeah.
then we've got another one coming through. Jabulani, I hope I answered your question there. We've got one asking for a friend. I had COVID, bronchitis, then pneumonia about 2 months ago. Now I'm very well recovered, but once a day or even per night, I have a sleeping heart rate that spikes to 199. What can this be? Now, that's something I experience on extreme exercise, which I don't think is quite normal, right, Doc?
No, it isn't. If you think about your maximal heart rate when you work it out for X, it's 220 minus your age in men and 200 minus your age in women. So a heart rate of 199 is not normal for anybody at rest. So I think that deserves to be looked at. The question is, what is happening before you measure that heart rate? Are you having a bad dream that you're running away from your dog or that someone's burgling your house, etc.? What are the conditions? And also the long-term effects of that COVID pneumonia and COVID bronchitis. Are you on any medications that could be causing an increase in your heart rate? Like, for example, things like sinus medication that can give you a tachycardia. Just a medical term for fast heart rate.
All right. Okay. So definitely suggestion there is to go seek some professional.
Yes, I think start off with
medical
your general practitioner for a checkup, you know, looking at your heart rate, and they might even monitor your heart rate for 24 hours, looking at what happens during the day and night to look for associated symptoms and triggers.
Brilliant stuff. Now, Namoya says, just thank you very much. And I think that's just for you guys here. We've got another one asking, how can I get rid of high cholesterol very fast? Can someone help me, please? So I think someone's heard some of the signs and symptoms and they're like, oh no, that's me. What can I do right now?
I think everyone wants a fast answer, but I don't think there is such a thing.
We want to undo like years of habits in like a week. We want to undo like 10 years of pies at the garage stop in 10 days.
No.
And, you know, the quick answer is you can't reverse it quickly.
Yes.
It's a process. Obviously, there is a place for medication. The medication and the group of medications is very specific, and one's got to look at your what's called your lipogram, your fasting lipogram, looking at which fats you actually have a problem with, whether it's triglycerides or whether, obviously, it's your LDL or HDL, all these big words. But basically what that means, that will assist you in recognizing whether you would actually benefit from taking medication, and also the role that changing your diet might play in lowering those levels first. No medication is without risk and side effect. When we give a patient medication, we always ask the question, does the benefit outweigh the risk? So I look always, when looking at a patient holistically, to always try and advocate that.
Correct, yeah. So I think people who can afford to, and they are on medical aid, for example, seeing a dietitian is really helpful, because then they can tell you what foods have less cholesterol in them, so that you could also assist with the drug therapy medication. You can assist in bringing that cholesterol.
I love that. But I do remember you did mention, of course, it was the salts and staying away from, there were 3 things you mentioned, right? It was salt, sugar,
and fats.
And certain
Good fats.
is a good thing to start off with if you aren't experiencing any severe symptoms. But I got to thank you enough, Doc and the Professor. You guys have been absolutely incredible. I can't wait to learn some more from you, but I think you've really served Mzansi and I suppose put us a little bit of ease when it comes to our heart health and promoted it for the better. So have a beautiful day, guys. Thank you for joining us this
Thank you,
morning.
and wear red tomorrow, okay? Well,
Yes,
hot day.
red tomorrow. It's World Heart Health Day, of course. So we're celebrating everything good about it and raising awareness. But again, for you, Mzansi, thank you for joining us and choosing to get educated. And here's some more belly feeding stuff for you to tuck into and keep that heart happy and healthy.